Sport and exercise therapy is quite an exciting new up-and-coming sort of profession. We are accredited by the Society of Sports Therapy, which means that we work under sort of 5 key areas of competency. So we teach our students how to prevent injury from occurring in the first instance. We also teach them how to examine and assess a new injury, also how to manage that injury, rehabilitate that injury, but also the sort of education and professional issues surrounding that injury as well.
Sport and exercise therapy will lead to a career of working with athletes and patients in different fields in terms of musculoskeletal care. So that's injuries related to the skeletal system, the muscular system, and also the neurological system. So it's a very applied, hands-on career and degree, which means that no 2 days will ever be the same.
We really emphasise the real-world learning component and the practical hands-on sort of element. So our students quite often will be in doing practical sessions. That's where the majority of their timetable will consist of. We also have a first-year massage clinic, which is running behind me at the moment. We also have the placement year opportunity, which takes place between the 2nd and 3rd year, where students can take a year out in industry and they can actually sort of do the job that they're looking to do.
We've worked hard at building a network of close contacts around the local area and beyond to provide students with workplace opportunities.
So it might well be that they're going out to different events, providing massage or sort of injury assessment and treatment at sort of 10Ks, marathons, half marathons. They also, students this year are going to the Gothia World Cup in Sweden to provide some pitchside treatment, and also they'll be doing some examination assessment there as well. So lots of opportunities, lots of practical hands-on. We want you to be able to go out and do the job effectively. One of the things about our staffing at Solent University is that we are all practical hands-on doing the job ourselves, so we're all still working in industry. I think our facilities are actually phenomenal for our course. We've got our teaching clinic that's behind me, so that's a 10-bed teaching room. We've also got another one next door, another 10-bed teaching room. In between that, we've also got rehabilitation gym, which has an anti-gravity treadmill, it has an isokinetic dynamometer in there, so really kind of top quality equipment in there as well. We've also got a brand new sports injury clinic, a 9-bed injury clinic in the top floor of our new sports building, which means that the students can run a clinic in their 3rd year. We've got 3 gyms, teaching gym, that the students will be in quite a lot for their sort of coaching and their rehabilitation modules. We've also got 2 sports halls, which again they will use a lot of the time, so it's facilities that we have, but they also get to use them as well. In addition to that, we've got the physiology and the biomechanics lab that ensures that we cover the sports science principles that are sort of fundamental to our programme.
So our students have fantastic career opportunities post-graduation, a range of different fields and environments. The obvious one would be in professional sports, but also at an amateur level as well. In private practice, our students can go on to either work in a private practice or set themselves up in their own business. And further than that, we've also started to develop ties within the NHS as well, so our students could go on to work as a musculoskeletal practitioner in an NHS environment. So I'd encourage you to come and study sport and exercise therapy with us here at Solent University because of our fantastic teaching team, our approach to teaching, our dynamic facilities and our real-world opportunities that our students will engage with throughout their 3 years of study.